Hi everyone, my name is Laura Sibbald and I'm a nationally certified speech-language pathologist, an autism spectrum disorder clinical specialist, and a certified youth mental health specialist. I have extensive experience in supporting the social, emotional, and pragmatic language needs of autistic students in the Washington, D.C. metropolitan area, as well as the Philadelphia region. I currently actually live in Philly and work as the Associate Director for Accessibility and Neurodiversity at Chestnut Hill College. And I also present nationally on trauma-informed best practices for neurodivergent individuals. I'm so excited to have you here with me today as we do this Facebook Live event to talk about PESI's upcoming Autism Symposium, their third annual Autism Symposium, if you can believe it. And if you remember, if you've attended the symposium in the past, I was the moderator for year 1 and year 2. And I'm so excited to say that I'm going to be back this year as the moderator for year 3. So I'm hoping that you're going to come along and join us on this awesome journey as we have another year of new and inspiring interventions to talk about with PESI. And if you're interested in registering, just go ahead and scan the QR code right above my head there. At this 2-day symposium, we're going to have leading voices in the field. So we're bringing back Temple Grandin and Stephen Porges for a keynote discussion, and that's really exciting. I apologize that my phone is going off here, but that'll stop in just a second. The focus of our symposium this year is really looking at strengths-based interventions and avoiding the kind of like outdated deficit-based models. So there's a lot that has been done with autism intervention from like a deficit-based or medical model, and we're really moving away from that, going into more the empowering, affirming, strengths-based approach. So the symposium is going to be on April 20th and April 21st. And again, if you want to join me, go ahead and scan that QR code right above my head. I'm going to be moderating, but even more exciting, I'm going to be doing kind of a panel at the end where we're synthesizing everything that we're learning and practicing and talking about how do I move forward from here. And I'm really excited about that, taking all of that information and pulling it all together and then taking those next steps. So for the symposium, something I should mention is that registration is actually completely free this year, and that's new. So that's really, really exciting. So I hope you come and join me on this awesome adventure. So the reason that I'm actually here today is, of course, to talk to you about hosting the symposium, and that I'm gonna be the moderator for you and to encourage you to attend. But also, I want to kind of give you a little bit of a sneak peek at some of the things we're going to be talking about. And so my area, for those of you that have seen me in the past, I do a lot of work with trauma-informed best practices and affirming practices. And what I want to do today is talk about how to implement a trauma-informed affirming practice to support self-determination in your clients. So as clinicians, we really are hearing a lot more about affirming therapeutic approaches now, and I think that's awesome. We've been trained, however, a lot in medical model and deficit-based models. So sometimes it feels like there's a misconnection there between how do I take my knowledge that I know from this other model that I learned in grad school and workshops and continuing ed and CEUs, and juxtapose it with this new like neurodiversity affirming model. And so what I want you to understand is, as a clinician, as a professional, as an educator, your knowledge is still incredibly, incredibly valuable, even in client-led or affirming sessions, because our role is the guide. It's not the master telling you what to do specifically, okay? So it's a shift in your framework. It's a shift in your thinking. So your expertise is absolutely still needed. It's just within this different framework. So let's take a look at something that, as an SLP, I've worked on a lot over the years: perspective taking. or a theory of mind. So you might have a client who's kind of struggling with the ability to take perspective of others, struggling with that theory of mind. And it could be within their school, it could be within a workplace. And you want to support that ability, but also be affirming at the same time. So the first thing I want to suggest that you do is don't make an assumption that the client lacks empathy or that they don't care about the feelings of the other person. And don't use reductionism, which would be saying something like, well, of course they have bad theory of mind, they're autistic. That is just feeding into stereotypes. It's feeding into kind of negativity, and it's just something we really want to avoid. So you don't want to make that assumption. You don't want to focus in on a deficit, and you don't want to feed into those stereotypes. So my suggestion is to start with strategies that we're very familiar with as therapists. Start using visual mapping, thought bubbling to get a sense of what maybe occurred during the situation. It could be, receiving or giving a birthday present or receiving a birthday present. They opened the present, looked at it, and didn't really react and maybe pushed it away. And in a previous deficit-based model, we'd look at that as, well, we need to teach you the appropriate way to respond would be to show gratitude, to show excitement, even if you don't like something that you received. In an affirming model, you're shifting a little bit. Instead of saying, I'm the expert on this and I'm telling you what to do, you want to empower the client. Remember from the ARC framework, that competency idea, empowering the client to understand and make decisions for themselves. So using that visual thought bubbling strategy to kind of map out what's going on, and write down what the client is saying so that you have visual reminders of that moving forward. So now that you have those kind of visuals for reference, you want to support your client in their ability to make a decision about what to do or what to say in a given scenario. So again, we want to empower that client. So if they pushed aside a gift, they're telling you, well, I didn't really like it, but I didn't say anything because I didn't want to say anything negative. Or I just don't like blue and I wanted to be honest. So you're writing down, you're saying, okay, these are the things that are happening. You as the guide can give insights into the perspectives of other individuals. Well, for some people, they may interpret it this way. You're still using that expertise to offer insights, but you are not saying this is what you should do in this situation. It's a subtle difference, but it's a big difference because that's all about empowerment. That means that you're giving the agency over to your client. They're the ones that are really leading forward and leading the session as they're telling you their experiences and their opinions. And you're guiding them with problem solving, with that, that executive function, with perspective taking, with pragmatics. However, they're the ones ultimately that are making the decision on what they want to do and what is true to themselves. Okay. So the difference is the framework. The difference is not actually your knowledge as a clinician. It's the way that you're implementing that knowledge. You're not looking to influence your client or show them something right or wrong. No, you're empowering them to make a decision. The mentality is that let me frame it out for you. Let me help your mind process this information. And then I am empowering you to make this decision. So you're giving them the tools, teaching them the strategy, and moving them toward that independence and self-determination. So I think that mindset shift is so critical when you're thinking just about neurodiversity affirming practices or trauma-informed best practices as well. For younger children, I've used what are called SOC tables before. You write down scenario, you provide a variety of options, or you discuss options with your client. You discuss their choices and the consequences of these choices. There's no judgment placed on anything. It's a visual guide and a visual map to problem solving. So this is how you can move your own mindset away from a deficit model to an affirming model. And I'm going to be talking a lot more about this next month at PESI's 3rd Annual Autism Symposium. So remember to go ahead, register. It's free. Scan the QR code right there. It's going to be April 20th and 21st, and I'm really excited to see you all there. Thank you all for your time, and have a wonderful, wonderful